Hey, good morning, everyone. Thanks for attending this. Actually, I guess now we're afternoon. Good afternoon, everyone. Thanks for attending. We are eager to share ideas with you about responding to the coronavirus and, be practical, stay legal. I'm sure, we've all been inundated with communication around the spread of the coronavirus. If your inbox looks anything like mine, so you've received dozens of updates from whether they're insurance companies or business partners or various media outlets. Understandably, this is uncharted territory for all of us. And we hope to share some ideas that will help you and your executive team make the best decisions for your company and employees based on your business needs. Um, so let's get moving. We got about an hour. This webinar has been approved for one SHRM credit and is still pending approval for one HRCI credit. The SHRM certificate will be emailed to attendees post-event, and the HRCI credit, once it's approved, I'll send that out as well. This webinar idea it was hatched just on Friday with Adam and Jeremy and I when we realized that there was so much to share about the coronavirus that wasn't being covered in the national news as it would impact individual employers and employees. So just a quick outline of our agenda. I'll provide some brief bios, then share some high-level insurance updates. Adam and Jeremy will then each provide insight into a few topics from telework to layoffs and several others. We'll then move to a segment where our panelists will jointly discuss recent client issues and potential solutions. Lastly, we'll move to Q&A from you, the audience, and try and close out right on time at 1 p.m. If necessary, we'll have a short overtime session to address unanswered questions, but we'll formally close the webinar at 1 so you can get back to your day and the SHRM credits if that's what you're here for as well. That's based upon that one now. So some intros, just me first. My name is Brian Klickner, and I'm with Risk Strategies. I've worked for over a decade as an insurance broker and another 5 years as an executive in a Virginia-based government contractor. Here at Risk Strategies, my team and I work with clients to create bespoke employee benefit programs that engage employees, maximize transparency, while controlling and mitigating costs where possible. From digital enrollment to custom mobile app enabled employee advocacy with health care experience management, to direct contracts with hospital systems and physicians, to removing the big four insurance carriers from the equation, allowing for enhanced client experience and cost mitigation. We're doing all of these things today for our clients. Next is Adam Kelly. Adam is a 20-plus year HR veteran and principal consultant and founder for ARC Human Capital LLC, with focuses on helping organizations reap the rewards of the promise of modern HR while meeting their compliance mandates. Primarily focused on small and medium-sized businesses, he enjoys seeing how well-run HR can have positive strategic impact on a company. When not consulting, he's an HR instructor for George Mason University's Executive and Professional Education Program and is one of only 41 active instructors nationwide for the Society of Human Resources Management. And Jeremy Schneider. Jeremy is a labor and employment attorney in the Washington, D.C. regional office of Jackson Lewis PC. He represents employers in a wide variety of employment, non-compete, and whistleblower litigation. Jeremy also provides advice and training to management to help employers avoid litigation, which is key. We all want to do that. So a quick insurance update, and then I'll hand it over to Adam. So COVID-19 or the coronavirus, as we all know, is a pandemic, is new terrain for all of us. Things are rapidly evolving. So I'll outline a few things here, but understand it's likely to change as the days pass. So testing, last week carriers were talking about no cost share testing. Testing is the actual test, the nose swab, and the lab charges associated with running that test. Test-related services. This week, the conversation has moved to the possibility of no cost test-related services, which would include a virtual visit, office visit, urgent care, emergency room cost sharing being removed if it is related to the coronavirus testing being done. That's still on the plate. It's being talked about. Testing cost, as of now, cost estimates range from $50 to $100 for the actual processing of the test. This does not take into consideration any associated office virtual urgent care visit with potentially. From what we know, CMS has said that this test is like a $50 test. So carriers are likely scrambling to negotiate terms with LabCorp, and others. The IRS issued guidelines on your HSA eligible plans. Basically, they said they have ruled that waiving cost sharing for the above will not jeopardize HSA tax favored status. When you're talking about insured medical plans or the fully insured medical plans that many of you that are on this may be covered by, generally speaking, carriers are making these changes and imposing them across their book of business. State and federal officials continue to promote no cost share testing or no cost testing. Self-funded or ASO medical plans, generally speaking, you will have to make some decision for your plan relative to whether they want or you want no cost testing and no cost testing and test related services. This is you. Please engage with your carrier and your insurance professional. We're recommending to our clients to agree to no cost testing. The space of no cost testing related services is emerging, so we really don't have, there's no consistency across carriers as of now. For these changes to the underlying coverage of self-funded plans, make sure you confirm with the stop loss carrier. There is no impact to the current rates, and that they are planning to cover COVID-19 related illness, same as any other illness as it relates to accumulating towards your individual stop loss deductible or aggregate stop loss attachment point. As far as treatment, there is no treatment for COVID-19, only for the symptoms and the illnesses that present and those who test positive and may have mild cases, pneumonia or beyond that. There's no vaccination nor antiviral medication at this time. As of now, carriers are all stating any treatment will be covered the same as any other illness, which means cost sharing provisions according to the plan coverage. So whatever your plan would cover for the flu or any other type of medical condition would be how they would carry that out, just with the provision now of like no cost testing. Lastly, on insurance, the guidance that we have is that self-quarantine is not considered towards the elimination period of your short-term disability coverage. There must be a disease diagnosis to trigger that elimination period. So with that, at a high level with some insurance updates, I'll close on that and hand off to Adam Calley to share some insights that he's prepared.
Hello, everyone, and thank you for joining us today. It's an honor to be one of the three musketeers here discussing the joys of life under the coronavirus. I do have a few slides to share. I'll be kind of popping in and out of being a talking head and sharing some slides. So let me just pull those up for you here. All right, can you see those, Brian?
Yep, we're good.
All right, beautiful. So just want you to know that on Friday, which seems like a long time ago when we talk about terms of the coronavirus, there was an article that was put out by the U.S. Chamber of Commerce in their company platform. I was prominently quoted throughout that article, 7 things to do when creating an emergency work from home policy for COVID-19. So if you have not had a work from home policy in the past and you're trying to figure out how do we build one quickly, this might be of some value to you, since that's exactly what it was targeted towards. So please feel free to take a look at that. Now, while we're on the topic of teleworking, Brian, I'm going to ask you to run a poll for me. I'd like to see how many of you can enable telework for your workplace. So it's very simple, yes or no. So please go ahead and respond to the poll. And while you do that, I want to share some ideas. We're going to talk about ideas for those of you who can and those of you who can't. How do you fill in time? You may have more work time than can be filled by somebody's job in the areas that they can perform from home. So a couple of quick ideas. And just so you know, this session is being recorded. You will be able to return to it. So if we seem to go a little quick and perhaps you're unable to take notes fast enough, don't worry about it. The recording will be available to you and you can listen to the Three Musketeers over and over. But first of all, I'd like to mention training. We're often too busy to get training done at work. This may be the prime time to get that virtual sexual harassment training done that you always talk about doing and you're always chasing after your staff to do it. So this is the time to get it done and check that box. Let's talk about performance appraisals for a moment. We're going to look at this from a few different angles. Many organizations will have their employees do a self-assessment of some sort as part of the annual or perhaps more frequent performance evaluation process. I would encourage you to have your folks start that process now. Even if it's not that close to your particular review cycle, they can at least get some things done. So as the result, the review cycle gets closer, they've already got some material done. For your managers, same principle. Tell them to begin doing reviews now. It's kind of an uninterrupted time. They're working from home, unless they have kids. We'll talk about that later, one thing at a time. They might find that a great use of their time. This also could be a good time for some customer outreach. A lot of times we say, oh, I want to follow up, do some check-ins, really make sure my people are feeling loved, make sure clients know we're looking out for them, and you're always too busy to get around to it. This might be the perfect moment. Again, I know you probably can't visit them, the whole social distancing thing being what it is, but phone calls, video conferences could all be great. And by the way, if you are like many organizations and you have testimonials on your website from satisfied clients, maybe this is a moment to collect those testimonials and perhaps make some updates to the website as you make those calls. Back to the point of what managers can do. I mentioned a moment ago that they can do performance appraisals, or at least begin them. Another thing that you may want to encourage your managers to do is something called stay interviews. A stay interview is kind of the opposite of an exit interview. You don't do it with everybody. You could, but really what it's meant to focus on is your top staff members. And a stay interview is a very proactive, smart idea. Even if we weren't talking about the coronavirus, I often recommend this. Get online with your best folks. Talk about them, what keeps them engaged at the company, what makes them happy, and what would make them leave. Because if you can find that out now, you can act on it. If you're in the middle of an exit interview, they've already put in their resignation, they're moving on, but that could be a good use of time for your managers. Department meetings can and should still happen. Perhaps they need to be done by conference call, but ideally, I would suggest you do them by video. We'll talk about the impact of video on engagement in a moment, but again, keep people focused on getting the work done and keep them focused that eventually this will pass. We will have an operation that's back up and running the normal way. We want to make sure folks are focused on that and business can get done in good department meetings. This may also be a time for audits. In the HR space, I would say, hey, why don't you take those I-9s home and really go through those with a fine-tooth comb. Many of you on this call, of course, are HR people, but not everybody. So if you're from a more operational point of view, what are the things that you always mean to look at and you never seem to have the time? Again, those materials might be available to you physically. They might be available to you in the cloud, but it might be time to do some audits. We also often talk about doing SOP updates, meaning standard operating procedures. Let's get those things down on paper. You never know who's going to quit or retire or whatever. That's the kind of thing that can also be done from home. There are many organizations on this call who represent government contractors. And I know that one of the ways that you can enable yourself to compete for business is by showing that your organization has various certifications at the organizational level. And here I'm talking about things like ISO, CMMI, or Six Sigma. Those are special efforts, they're corporate efforts, they're outside of the realm of the work you perform for your clients. This could be the perfect time to begin to identify what work is going to be done by who and divvy that work up so that folks can begin to craft the materials required to earn those certifications. Because when the coronavirus is in the real view mirror and we're all moving on, getting those certs can, again, help your organization compete for new business. And finally, this might be an opportunity to craft some marketing materials, maybe have some people write some white papers. Now, that's all great for those who can work from home, but what about those who can't work from home? There's a lot of blue-collar workers out there. I know we've got some folks potentially online from that space. What do you do with them? Well, just throwing out some ideas. We're talking about things like maintenance, repairs, cleaning. And I'm going to ask you to go back in time with me for a moment. Let's talk about the recession. I paid a visit to Honda, and I'm talking about the motor company, up in Marysville, Ohio, a couple years ago. I was up there teaching for SHRM, and while I was there, I did a tour of their facilities, and very interesting place. Never been to a assembly line like that. And I asked them, what did they do during the recession? And they told me they did not lay off a single person. Now, I'm not saying you should do what Honda can do. We'll talk about that more in a moment. But here's where I'm going with this. They found work for everybody. Blue-collar employees working on an assembly line clearly cannot telework, right? Find the work. Create the work. And what could that be? That could be upgrades of systems, installations. You know, a lot of times we're talking about switching over between systems. We try to do it at midnight on a Tuesday, or we do it on a weekend so as not to interrupt the operation. Perhaps this is the time to make some system upgrades or some crossovers that won't interfere since people are not there. This is the time for beautification projects. My friends, let's get that employee break room painted. Let's get the outside of the building beautified. It's springtime. It's time for mulch. It's time for planting flowers and bushes. Those are the kinds of things that may seem like make work in some ways, and to a certain extent they are, but if they benefit the company and people are still earning their paycheck, who's going to complain? So look for those kind of opportunities. Community service on behalf of the company. A lot of organizations pay people to do that already. But at this time, when our country really needs to pull together, maybe you get some folks to go out and pick up food and deliver it to food banks. And you pay them for that. I'm not saying you can do this. I'm not saying you should do this. I'm saying this is the time for creative problem solving. And if you're in HR, people are looking to you for creative solutions. So here's a couple for you. This also might be a time, I mentioned compliance training for those who are working from home. Compliance training for those who are still stuck in the office and can't work remotely. And while we're on the topic of training, let's talk about cross-training. There may be some opportunities that other people can develop new skills that make them even more valuable to you, and they've wanted to grow, they've wanted to learn, and now you can take the time to show them. So let's go for it. Now, a moment ago, I mentioned the Three Musketeers. I was mentioning classic literature. And now I'm going with pop culture. So I hope you recognize this gentleman. That would be Captain Jack Sparrow of the famous, Pirates of the Caribbean. And he has a funny statement that I always like. He says, the only rule that matters are these: what a man can do, what a man can't do. And what I'd like you all to take that, now I'm not trying to be sexist, I'm only just quoting the captain here. What I'm trying to get for you to think about is this: long term. This coronavirus issue is not going to be over in a couple of weeks. There is reason to believe that we could be wrapping this up somewhere in the July or August timeframe. So as you begin to think about what you want to do for your employees, I want you to think, as Captain Jack says, what can you do and what can't you do? Because you might look me in the eye and say, Adam, we want to be like Google. Google is saying we're paying all of our people, even those who are not working as full as they usually would be. My local school system, everybody's off, my kids are at home. The school system has put out the word that everybody's getting paid. That's great. You may want to do that, but can you? I would caution you to not be making plans that are going to last the next 2 weeks, but rather make plans that are going to last 2 and more months. There has been some speculation that we might hit the peak of this issue in early May. Now, my friends, if the peak is in early May, that means we got to come down the other side. And I don't know how far down the other side it's going to take it before we can sort of get back to running normal lives. So my caution to you here is this: think about, what do you need to do to maintain the entity, the company, in the long term? Preserve your flexibility. Don't overcommit too early. I was speaking to one client, and they were saying, we're debating how much we should allow our employees to go negative in PTO if they have to use PTO, they can't work a lot from home. My advice to them was, approve it in stages or in phases. Don't say, oh, we'll let you go unlimited PTO. Say, we're going to give you 40 hours. Then maybe we're going to give you 60, 80, 100. Because if you don't have revenue coming in, how are you going to pay the folks who are drawing from their PTO? I'm not saying you shouldn't do it. I'm not saying it wouldn't be a great thing if you can. Certainly your employees would really feel that you're committed to them. But there's only two things that matter: what you can do, what you can't do. And that means that HR needs to be having some very tough conversations now. The boardroom needs to be analyzing these difficult situations now. I'm not saying that you should make those decisions now, but I'm saying conversations need to happen now. What kind of conversations am I talking about? Go back in time with me to the recession. There were organizations back there that had to take drastic moves so that they could survive. They did things they didn't like because they knew if they survived, the people who stayed with them would remain employed. Whereas if they go out of business, everybody's unemployed. And meanwhile, people who they either laid off or furloughed, they could come back to work or be reemployed. So you need to be thinking about long-term survival. Some quick examples: painful, unpleasant examples, but things that I know were done in the era of the recession. Cease your 401k contribution. Clearly, nobody's going to be happy about that. But I'm worried about getting through the next 4 months. I'm not worried about my retirement that's 20 years from now. Obviously, there's some paperwork that goes into that. You can't just stop doing that, right? That's a whole nother conversation. But explore that. Pay cuts. Nobody's going to be happy with a 20% pay cut. But I'm going to guarantee you that most people who take a 20% pay cut are going to make a lot more money than unemployment would pay them. Not saying you should do this casually, not saying you shouldn't discuss it. And obviously, you've got to crunch the numbers and figure out what should you do when. But this is the time to have those conversations. And this is the time to crunch the numbers so that you're looking at this in an informed way. Another thing to think about is, of course, furloughs. Again, if you're talking about exempt staff and non-exempt staff, there's different ways that we have to structure those. But furloughing people at least means that they know they're still employed, they have the benefits of employment, and at some point, they'll return to work. I would caution you, though, make sure that furlough is open-ended, because you don't know. We're talking about a bunch of different people and a bunch of different geographies with a bunch of different industries on today's call. I can't tell you how your industry and your geography are going to recover from this issue. What I can tell you, though, is think long-term, think about making gradual commitments, and start having tough conversations now. And I'm going to encourage you to think about the timing of this. And here's what I mean. Let's say you gave everybody a 10% pay cut beginning next Monday. Some people might say that's drastic, that's overreacting, that's going too far too fast. And I'm not saying I disagree with that, but hear me out. If you start that pay cut now, you're saving that money and it's going to last you longer. If you wait 2 months before you start it, for the next 2 months, you're still paying out your normal rate and you're drawing down your reserves, and it might not last you until a July or August timeframe. These are some of the practical concerns that we wanted to give you on today's webinar, and obviously keeping in mind the legal aspects. The last thing that I want to talk about is the fact that the government is trying to help us. There's this old joke, I'm from the government and I'm here to help. Well, they're doing a lot of different things. We'll be talking more about that. Jeremy's got some things when he comes up. But one of the good news is the government has postponed filing your taxes from April 15th until July 15th. So if you're like me and you know you owe a few $1,000s and you were already prepared to pay that, you know what? I'm not paying it April 15th. I've already filed. I'm good to go. But I'm going to reserve that money for my operations, and I'm not going to make the payments until early July. So your organization benefiting from that may be able to free that money up to continue operations, and then maybe some of those other drastic items are not as necessary. All of us are watching this issue very closely. When we advertised this, we said this is uncharted waters. That's one of my new favorite phrases these days. So watch closely, because all of those things might impact what you need to do, but nonetheless, I encourage you to think carefully about what you can do. And the final point that I want to mention is, how do you remain engaged with people? A lot of folks are working from home full-time for the first time ever. We're used to working from home for snow days. A couple of days, it's no big deal. This is not a couple of days, and it is a big deal. when we talk about social distancing, what I want you to understand is it does not mean social isolation. Brian and Jeremy and I were online yesterday, as we are now, preparing for this webinar. And I said, you know, guys, one of the beautiful things about all three of us being on video, on Zoom together, is at least I'm feeling like I'm interacting with people. There's a more energy in the room rather than just sitting here in my home office the same way I usually do. So as you're thinking about how do you keep people engaged and how do you keep people connected and energized, but still maintain social distancing, I'm going to tell you, don't email people, call them. Hearing somebody's voice can really be uplifting. Use the video capabilities that are easily available nowadays. Instead of just calling, instead of just emailing, let's go ahead and roll into Zoom. Obviously, instant messaging and text are great. I mentioned earlier, conducting those department meetings so you still feel like part of the team, and maybe scheduling those daily check-ins. By the way, please stay busy planning for the future. Give people reason to be optimistic. This won't last forever. Social distancing is necessary, but it doesn't mean we have to be isolated. Those are my quick practical bits of advice. Again, I know we went fast there. Oh, I'm sorry. One more bit of advice for those parents out there, not just for those on the call, but for you to share with your people. We need to be more adaptable than ever before. We know school systems across the nation are closed, and we know that our policies usually say when you're working from home, you're not taking care of your kids, you're just working from a new location. I got news from you. Everybody's taking care of their kids now. No surprise. So be cautious about enforcing those old rules and, in fact, help them to think creatively. And let me give you an example that I borrowed from a colleague of mine. Her and her husband both have young kids, and they're both working from home. How do you take care of little kids and still manage to work and be effective? Here's what they came up with. They get up early in the morning before the kids wake up, and they both work for a while. Then mom works in the morning, and dad takes care of the kids. Then they have a family lunch together. And then mom takes care of the kids, and dad works the afternoon. And then kids go to bed, and mom and dad go back to work for a few more hours. That is the way that they have determined they can best manage the operation in their household. Think about that for yourself. Think about sharing that. Now, I know some of you hardliners out there are going to say, my people should be working 8 hours a day. Welcome to coronavirus reality, my friends. Things are different. And so, by the way, what do you do if you're a single parent? Well, if you have some neighbors who are also parents, maybe you send your kids there and you work half the day for free and no worries, and then you switch and you've got the kids. That might be good. By the way, my daughters are both great babysitters. You might be able to hire them too. But now enough. Jeremy, I turn it over to you, sir.
Thanks, Adam. Appreciate it. Brian, maybe you want to do the results of the poll. So it looks like almost everybody can work from home, which is great. That's a good option for your staff. I'll just add one thing before I get into my kind of main topics about teleworking that Adam sort of reminded me of in his last bit there about being flexible. You know, we, in the first couple weeks of this, had a lot of clients calling and asking, okay, how do we get a telework policy up and going in the next 24 hours? Because we're going to close, you know, the physical office on Monday, and we want everybody to be working from home. And, you know, of course, throughout the years, we've helped lots of clients do that. What we haven't done in recent years is tell clients how to do it in this current environment. And in this current environment, the kind of the watchword is flexibility, while also making sure that you are not, or that your employees are able to complete their work, right? So that's the balance. You have to strike it with, okay, if our folks are going to be working from home, what is it exactly that we can expect from them, while also giving them some flexibility in order to manage, you know, this sort of new paradigm that we're currently living in. And one thing that we have come up with and have helped some clients with, I'd be happy to help anyone here, is kind of a work from home agreement, which is worked out between a supervisor and an employee on an individual basis. It sets out the expectations for the work from home arrangement, sets out the hours that a person plans to keep, and we advise our clients to be flexible if they can be on that. Also makes clear that the employees are expected to continue performing their job as required, but of course, allowing them to do it from home. And so that's one thing that, our firm has helped a lot of clients do in the last couple of weeks, is come up with these individualized telework agreements. But on the topics where I was thinking of focusing is when I was preparing for this, or when we were all preparing for this, I thought to myself, okay, what are the 3 or 4 things that clients are calling me about right now almost every day? And, the one that I think is probably the most difficult to navigate actually hasn't changed a whole lot in the last couple weeks. And the reason for that is you'll get the same questions from me on this topic that you would any other time that you call, putting aside the coronavirus at all. And that's the topic of layoffs. So I've been helping a lot of clients in the last couple days navigate issues related to having to lay folks off because of the current environment, the sort of unpredictability of funding, especially for nonprofits. That's an issue that's coming up more and more. Restaurants and bars having to close locations entirely or operating on a skeleton crew for takeout or delivery. It seems like a lot of cities are sort of shaking out that they're allowing restaurants to remain open, but only for takeout or delivery. And so, what do you do when you're faced with potential layoffs? And so what I've been telling clients, or what I've been talking to clients about, really are the same things that I would talk to you about if you called me 2 months ago and asked me if you were going to let somebody go, right? So the questions I typically run down are, okay, let's talk about this person as an individual that you're deciding to let go. What is their role in the company? What are the things that they do every day? Who's going to absorb their duties? Do you have a plan to replace that person in some time in the foreseeable future? Has that person complained about anything in the last couple months? Has that person complained about discrimination or unfair treatment? Are they complained about retaliation? Then of course I ask, clients, okay, let's run down whether or not that person is an older worker. There's, for folks who are over 40, which sounds ridiculous, but that's the way the law shakes out. Folks who are over 40 or older workers, there's a special set of circumstances related to them. They're sort of an at-risk or riskier population to let go of. If you're talking about letting go of multiple people, now we're talking about, let's compare these people to one another. Why are you choosing these people in particular to have their jobs be eliminated, right? And so we want to try to eliminate all the risk that's associated with the specific layoffs that you're planning to conduct before you go forward and conduct them. And I'll also tell you that, there really hasn't been a client where I've said recently, absent circumstances where you've got an employee who's recently complained about something or something like that, where I've said to them, okay, you shouldn't be letting these people go. Now, I'm not recommending letting people go. I think Adam raises a good point that, this time requires some flexibility. It requires some nimbleness, right? You want to make a decision based on long-term health of the organization, assuming that we're going to be in this for a number of months now. But when push comes to shove, and I've had government contractor clients call me about this issue, I've had nonprofit clients call me about this issue. If in the next couple months, that your funding is not coming, then you are going to have to make some hard choices. What I typically recommend is you give somebody like me a call. You just talk to us. We will walk you through. It's a 20-minute conversation. We answer all these questions. Of course, there's always, like any other termination, there's always considerations about when you let somebody go, when do you have to give them their next paycheck? Do you have to reimburse them or pay them for their accrued PTO? Do you have to pay them for their accrued sick? These are all the same questions I ask every time a client wants to let somebody go, but you still have to think about these things in this context. and specific to coronavirus, I've been asking clients questions like, okay, has this person said that they have some symptoms? Has this person, recently been out on medical leave? Has this person complained of a cough, or have you visibly observed them appearing to be ill? Now, we'll talk a little bit about what the EOC has recently said about sort of your observations and your interactions with employees who may have illnesses right now in this kind of pandemic that we're working under. But we'll ask those same questions. You don't want to target, it's not about targeting an employee. It's not about terminating an employee. You have to think of it as eliminating a position and why that position is necessary to be eliminated. And like any other employment decision that you ever have to make, you have to have a legitimate reason for it. You can't just throw your hands up and say it's coronavirus with no sort of grounding, right? The issue has to be, okay, the coronavirus has led to this reality. The reality is the government has shifted its focus. It has, canceled our contract because it's going to dedicate resources to something totally different. Or for nonprofits, it's, we know that our large donors, our regular donors, are not going to be giving to us because they are, sort of hoarding their money right now. They're conserving their resources, really. Wouldn't want to call anyone a hoarder, but I'm saying they're conserving their resources, which is understandable. I think we're all doing that same thing. So those are the big considerations for layoffs, but they are typically the same as they would be any other time, with a little bit of a riff for this specific issue. The other thing that I get a lot of questions about, and this is recently, only in the last couple of weeks, the EOC issued some guidance about what employers can do in the face of coronavirus. Now, the EOC's guidance is somewhat limited this time around, but the reason why it's limited is because they put out an extensive guidance when the H1N1 pandemic took place about 7 or 8 years ago. Was it 2009 or 2011? But in the last 10 years, the EOC issued guidance that's very similar. The new guidance is short. It's only, a single page on the website, but it refers directly to the old guidance it issued back when H1N1, when that outbreak took place. And what you really have to kind of make, the way you look at this guidance, and I think it's the most important thing, is that at bottom, at its base level, the ADA still applies. So your normal requirements under the ADA are in place. They continue to remain in place. There is no get out of jail free card for the coronavirus, right? But what the EOC has said is that the new guidance that they issue with regard to pandemics does rely upon what the CDC and state and local governments have said are the things that employers should do in reaction to the pandemic. So, for example, one of the main things that clients have been calling about is what kind of information can we ask of our employees? What are the questions that we're allowed to ask given this environment? Normally, the ADA would preclude employers from just asking their employees all the time if they're sick or if they're not feeling well, right? But because, and this shift happened in the last couple of weeks when the World Health Organization declared this a pandemic. When that formal shift happened, the EEOC issued this guidance that basically permits employers to gather more information about their employees in light of the risk of exposure to other employees, right? And so think about what the ADA really is about, or what all employment discrimination laws are really about. It's about making the workplace safe for everyone who's there. In OSHA, for those of you who deal with OSHA, manufacturers, typically that's where a lot of those OSHA issues come in, but there's also under OSHA guidance, there's a kind of a general duty that all employers have to maintain a safe working environment for their employees. And of course, a potential pandemic or a potential outbreak of an illness would implicate that. And so what you're allowed to do now, I think, and under this situation, is be more liberal with what you ask your employees. So you can ask your employees if they're experiencing symptoms of the pandemic virus. So you can ask them if they have recently had fever or chills or a cough or a shortness of breath or sore throat. Now, what you do with that information remains the same as under the ADA. If you gather sort of medical information about your employees, you're supposed to maintain that confidentially. Don't reveal that to anyone else in the workplace. One question that I got a couple weeks ago, and I wasn't really able to tell employers that they were allowed to do this, was the issue of taking body temperature of their employees. Now the EEOC has said that generally asking someone for their body temperature is a medical exam. You can't just willy-nilly require medical exams in the workplace. But now, because the CDC and state and local health authorities have acknowledged community spread of coronavirus, you can measure your employees' body temperature. Now, that employers, and the guidance specifically says this, employers should be aware that this alone doesn't mean that someone has coronavirus. There are folks who have a fever for other reasons. There are also folks who have coronavirus who don't have a high temperature. So you do need to keep that in mind, but you can, as a condition of being on site during a pandemic, ask your employees to consent to you can require that they have their body temperature taken. Another thing that the guidance specifically talks about is you can require your employees to stay home if they have symptoms of the coronavirus. So if somebody does have a fever, you can tell them to go home and require them to go home. Or if somebody has a sore throat, you can tell them to go home, require them to be home. This doesn't, and this is consistent with the CDC's guidance. So a good place to look if you're thinking about dealing with these issues is to, and because the EOC specifically points to it as the authorization for you to take these actions, you should look at the CDC guidelines for employers. You should look at the World Health Organization's guidelines for employers. They're prominently featured on the government websites right now. A lot of you probably already had, some of these posters put up in your offices. I know in our restrooms in our office, before we were all banished to our homes, we had posters from the CDC talking about hand washing and all that. You should get those posters if you're still on the work site. You should get those posters, download them, print them, prominently display them in places where people will see them. And look, if the government is telling folks, and through the CDC, or we get to a point where there's these sort of work in place, or these stay in place orders that could come down from city to city, and of course, and I think in San Francisco right now they have one. What you should be able to do is follow that guidance, and that's what these EEOC guidelines are really all about. It's about public health, and so when the experts on public health tell you to do something, you can do that without worrying about a conflict with the ADA. One other thing that you can do under this new guidance, is you can require, when your folks are ready to return to work, you can require doctor's notes certifying their fitness for duty. Now, doctors have much more pressing issues right now than issuing fitness for duty requests. There may be some delay. But, and again, this kind of calls back to Adam's point. You want to be flexible. You want to recognize the fact that you can require a return to work fitness for duty note, with the fact that, the doctors may not get you that information super timely, and that can be taken on an individualized basis. The last thing that I'm getting a lot of questions about is this new law that's out there that the House passed last week and that the Senate is currently considering. And there's really two provisions in this law that we're getting a lot of questions about and that employers have a lot of concerns about. The first is an extension to already existing FMLA requirements that are sort of targeted at the coronavirus and folks who are displaying symptoms of the coronavirus or seeking treatment for the coronavirus. And then paid sick leave for the same categories that you're extending protection for under the FMLA. So folks who have a diagnosis, folks who live with a person who has a diagnosis, folks who have come into contact and have been recommended by a doctor not to expose themselves to other people. Those folks would be eligible for 2 weeks of paid leave under this new law. Also, the FMLA extension would specifically extend FMLA benefits to folks who meet those conditions, and I believe there's 5 under each provision here in the law. The big one, though, that I think there's really 2 big things in this law that I think are the reason why the debate is still going on, because they are a significant change. The first is one of the eligibility requirements for the FMLA and the sick leave are you can take this new type of FMLA leave or take this paid sick leave if you are a parent who has a child who's under 18 whose school has been closed as a result of the pandemic. And so really that's huge. Adam is talking about issues with teleworking, with parents with small children and how they work out teleworking, but we're talking about paid sick leave for all parents who have a child under 18 whose school is closed. That's basically every child in at least on the East Coast and most of the West Coast, really almost every state now at this point. There's only a handful of states that haven't closed most of their schools. And so we're talking about a serious expansion of the law, not for people who are sick, but for people who have childcare responsibilities as a result of the pandemic. I am seeing a question in the chat that says, has the bill already passed or is it still under consideration? And is there somewhere that summarizes this law? So first question, the House has passed it. Then it goes to the Senate for debate and consideration and vote. The last I read over this week was that the Senate is likely to take up a vote either today or tomorrow on the issue. That's what people are saying. When the Senate passes the bill, it'll go to the president for signature. The president's pushing it, so it doesn't look like it's an issue in terms of the president vetoing. The second question was, is there somewhere that references or summarizes the law? So my firm has got about 800 lawyers, but we've put 40 lawyers on the case on the coronavirus, and then we have a kind of a task force. And if anyone wants sort of some of these summaries, we've got blog posts, we've got a lot of resources, completely free of charge out there. And one of the resources is a summary of this bill. If you want to email me or connect with me on LinkedIn, happy to send you to all of that, all those resources. No problem at all. The other piece of the law that I think is pretty big is that if you meet one of the conditions for the new FMLA leave, you only have to, there's actually really 2 more pieces. The first is employees who have been employed only for 30 days are eligible to claim these FMLA benefits, which is a huge difference over previously, which is usually a year or 1,250 hours worked. The second piece is part of this FMLA leave will be paid at 2/3 of your actual salary. And those payments are the responsibility of the employer. So, and the paid sick leave, also the responsibility of the employer. And that's up to 14 days of paid sick leave for coronavirus-related issues, 5 or so categories that are specifically laid out in the law. The DC Council, I'll just mention this because I saw it 20 minutes before we started. The DC Council passed a law this morning making unemployment benefits eligible to people without a waiting period. So if anyone has lost their job as a result of this situation, there's no waiting period right now for the benefits. You'll get them in under 30 days. A couple other provisions in that law, but that's kind of the big one. And really those are the 3 topics that I think were most important to me. Obviously, these things are changing every day. We're having a lot of calls come in. Secretary Mnuchin urged Congress yesterday to pass the measure and an additional sort of relief package for the economy because he's saying that it's possible we could get to 20% unemployment as a result of some of these things, which would be unbelievable. I mean, that would be just, we're talking about real recession level unemployment. And so Again, it's an everyday thing. If this Senate law passes and they say that it's going to change somewhat, so some of these FMLA issues are going to be, I think, pared down somewhat. That's what it's looking like. That's another thing we just have to keep our eyes on. And I'm seeing a couple other questions. Brian, I don't know if you want to.
Yeah, so one of the questions that was asked was, so when we have an employee who tests positive, can they require them to disclose, and how can they use that information? Additionally, they're asking for those who are sick and unable to work, would that fall under workers' comp or short-term disability, or would it depend? Will PTO be considered sick leave under this law? So it's kind of a lot to unpack.
It is a lot to unpack. Let me pick a couple of those things. All of the benefits under this new law, let's just assume that it gets passed as if it gets passed as the House version and the Senate approves it in full. Those benefits that are allotted under that law are in addition to what an employer already offers. Okay, so that's, you're going to have some issues with stacking of the benefits. There's going to be a lot of things to work through, but the way it's written right now, it's on top of what you already offer. Okay, that's the first bit. That's being PTO considered sick leave under the new law. It's paid sick leave, and a lot of states and local governments in the country right now have similar paid sick leave requirements that are that is a much larger scale than what this bill is for. It's really 14 days of paid sick leave. Workers' comp or short-term disability. Short-term disability, perhaps, that's not my area, but I can reasonably see an employee claiming short-term disability as a result of a diagnosis, and that claim would be granted by a short-term disability provider. Whether or not it's workers' comp is a weird question. If you had a diagnosis in the workplace, you had an employee who was actually diagnosed, and that employee gave it to somebody else in the workplace, there's an argument that could be covered under workers' comp if it was sufficiently debilitating. A lot of these things are, I hate to give the classic lawyer answer, but a lot of this is, it depends. And so you have to look at these things on an individual basis.
Jeremy, I just wanted to add something to that real quick. So, and please chime in if I'm wrong here, but one of the things that's supposed to make this doable for the American business community is that you will be able to get a tax credit of some sort when you pay your employees for the leave under the new law, right?
I don't have that in my summary of it. I haven't read the bill in its total, but I've read the articles about it. I've read what our firm has put out. I haven't.
Well, it's 110 pages long. How come you haven't read it all?
Like anything that the government puts out, there's a lot extra there. That would make sense.
Here's where I was going with that. And again, as Jeremy said, and I'm just totally in agreement, this is still working through the House. The House and the Senate may need to refine their version before it goes to the president. But I am pretty sure that the reason that it costs so much is because the federal government is going to help the American business community to pay for this. So I had a client just the other day who said, well, we have PTO. In fact, they actually practice unlimited PTO. But they said, how are we going to be able to claim a tax credit from the government if one of our employees is ill or is caring for someone who's ill or is home taking care of the kids, etc.
Right.
And so my recommendation from a practical point of view was go into your timekeeping system or your payroll system or both, whatever. Create new time tracking or earnings codes. So I understand you have PTO, but now I'm going to say create some new code. Let's call it pandemic leave. Let's call it coronavirus leave. I don't care about the name. And anybody who takes leave for these reasons will use that labor code or that code, that earnings code, timekeeping code, because at the end of the year, if you want to be able to say, oh, well, we spent $10,000 on this, I want to offset part of my tax bill with that 10 grand, you're going to need to be able to substantiate that somehow. And if all you have is this lump sum PTO that you've always allowed your employees to use, how are you going to break it out? The answer, you're not really going to be able to break it out. So I would say, and this is like a no-cost, very easy thing to do. It takes a few minutes working with your payroll provider, your timekeeping provider. Set up this code, explain it to your employees, inform them that the use of this code is just for these reasons. And most importantly, I would suggest make sure they understand this is a temporary thing. As Jeremy has said, you know, the law is still in the works, right? We don't know what it's going to look like. But it did say that the law would sunset, meaning it's going to end December 31st.
Yep.
Well, if that's the case, then your new benefit is going to sunset December 31st. Now, again, I'm just saying this based on preliminary information. So let your people know that it is subject to change at the sole discretion of the company, and you'll just have to monitor, because if you allow them to take it and you can then offset part of your bill, that's going to make it more affordable. Back to you, sir.
So as a, I'll close with a question, but so in our company, what we've done, this is kind of goes back to this question that Jeremy had answered, is if an employee, we've set up kind of a chain of command. If an employee figures out they believe they've been exposed or they're experiencing symptoms, there's a requirement that employee then, this was as of Monday, that employee is to notify a specific person in the office, and then they are to self-quarantine. Fortunately for us, we're in a position where we can telework easily, but we provide notice to one of our managing directors. Therefore, privacy is maintained. The reason for why we would potentially be self-quarantined, or if we come down with symptoms and need to not be even able to telework at that point in time, that's still protected because HIPAA still does apply. Then that's notified up to the appropriate chains of command inside of HR. So, you know, empowering and setting up that who you talk to and who you're allowed to talk to, and who employees should be reporting these types of conditions to, in an environment where you have employees still reporting to work, whether it's a grocery store, you know, a parking management company, a CVS or something like this, it even is even more important, right? And this is where, you know, our suggestion is to start game planning these types of critical scenarios early and have kind of a planned progressive response, as opposed to kind of, as I think when we were talking with Adam on our call and Jeremy yesterday, if we launch everything in the next week that we fire all of our kind of missiles at this problem, it can have, and we may not have anything left to be able to do, right? So kind of going through these scenarios of planning out what's the economic impact should we do this, whether it's, you know, required telework, whether it's a shift duty, even for non-knowledge workers, right? So, or for knowledge workers, right? This is a scenario that Adam, we talked about a bit yesterday. If you need to have somebody in a knowledge working environment that still goes into an office because that's required, you know, have conversations, whether this is a GovCon, having conversations with your customer, and being able to have employees, whether they are remote for 1 week and half of them are remote for 1 week and half of them are on site for 1 week, and then rotating that so that you can limit the amount of potential community spread that's there, or just splitting days in half so that you can, you know, provide the best service to your customer in a GovCon situation. I do want to ask this question because this popped up. It's can an employer require telework instead of FMLA for a school closure? So I sent that over to Jeremy. So I'm curious what your thoughts are on that.
So, okay, under the current FMLA, now I'm going to answer the question in a kind of a general way, and then there are, in every locality, especially in the DMV, I'm assuming that a lot of us are in the DMV, but elsewhere, there are nuances to this. So generally, under the FMLA right now, before this law is passed, simply a school closure wouldn't qualify for the use of FMLA, unless the child was sick. You have, you know, FMLA covers parents who take care of sick children. That's fine. But for a general school closure right now, that would not apply for FMLA leave. Assuming that in a week or two we have this new law, and there's this provision in here that says, you know, a school closure as a result of the pandemic qualifies for FMLA leave, I think you need to treat it like regular FMLA leave. If an employee has a qualifying event and they request it, and it meets the criteria for a qualifying event, I think you have to give them that FMLA leave. Now, Again, I think what's going to happen I think what's happening in the Senate is some of these provisions are getting pared down. For example, the 2/3 pay while on FMLA leave for coronavirus is to an employment lawyer who represents management. That's shocking to me. That's so much further, so much more generous than anything we have on the law right now for FMLA that it would be surprising to me if that ended up in the end. But again, I don't work on Capitol Hill. I don't know. It's a crazy time right now. Things are happening and we're out of time. I think all of us are going to stick around for a little bit if you all want to ask some more questions, but this is kind of the official end and I'll let Brian take it.
Yeah, absolutely. Hey, thanks, Jeremy. So yeah, we're going to go into overtime. I see some questions that are unanswered, and we fortunately, both Adam and Jeremy have been generous with their time, and our schedules are all aligned that we do have a little bit of extra time to go into overtime. So I'm going to bounce another question in here that I think, let's see. So feel free to sign off if you can. If you have additional questions, you can put them in the chat. I am looking at the questions that have been asked through the actual question feature, and I'm kind of pushing those over to Jeremy and to Adam so that they can address those. So here's a recruiting question. So the question I have is, can you ask potential employees if they are ill or exposed?
Adam, you want to do that one or you want me to do that one?
Well, I'll take the first stab at that. So read an article yesterday on the SHRM website, and they were talking about recruiting and how it's going on right now. And while someone is still a candidate, right, as a recruit, not yet as an employee, the article was talking about how many companies have curtailed face-to-face in-person interviews and have replaced them with video interviews, right? So I do a phone call with you the way I always do. I like you, you look promising, and then I bring you in, right? Not anymore. Now, instead, what I do is I set up a Zoom, assuming that I can, or some other, what is that my kids use on their Apple iDevices, FaceTime. So whatever technology you want to use, that's an option. Now, let's talk about start dates, right? So I've interviewed you, I've sent you an offer, you've accepted it. I've seen some companies that are delaying start dates because look what I said to you earlier. If I'm talking about furloughing people and laying people off and doing pay cuts, why am I going to add more staff right now? That being said, if my business is in an industry and things are good, that I do need to add people and you do want them to start, well, then you want them to start, you set up the start date and you do the same thing, explaining to them what you're doing for some of the social distancing. We've heard Jeremy, we've heard Brian talk about maybe you're having staggered shifts, whether it's work days or times of the day, or work weeks. So you're going to need to inform them how they fit into that as a new hire. Now, whether or not you can say, by the way, don't report to work unless you have no temperature. I will mention something personal and anecdotal. Yesterday, I took my 17-year-old son to the doctor for a reason completely unrelated to coronavirus, not corona beer. And I go in and the doctor does all the normal things, height, weight, blood pressure, all that stuff with my son, who's the patient. And then we're about to leave the room. And she says, hold on, I need to take your temperature. And I looked at her, I thought she was joking. I said, why do you need to take my temperature? She's like, our policy right now is we take the temperature of everybody who accompanies one of our patients. So of course, being the smart aleck that I am, I said, you're not gonna charge me a copay for this, are you? And she said, no. And she took my temp and I was fine. But my point in sharing that is it fits in exactly with what Jeremy just shared. If you're gonna have a new hire and you're gonna follow that EEOC guidance, maybe you should let them know, listen, for the duration of this pandemic, we're doing this because you don't want to surprise a new hire. That's a pretty awkward way to welcome them to the company. You're going to give them a fist bump, not a handshake, and then you're going to stick a temperature thing in their ear, right? So I would caution you how you control the message. But as far as the practicalities, I think my friend Jason has Jeremy has pretty well covered that. Jeremy, anything else you need to add, given the focus on recruiting?
No, I mean, I think that makes a lot of sense. Again, it's like the layoff question. Do what you would normally do. Don't not give anybody a job for some protected, or for some, because they're a member of some protected class to Don't not hire somebody because they were recently diagnosed with this or they're showing symptoms, right? Recruit them as you normally would. And then when it comes time to an offer, you've got these business decisions that you're going to need to make about when you have a start date. It's always good to be communicative, open, and upfront. So I would agree with that. If I could just share, so somebody asked in the chat, if the kids are not sick, but worker is home taking care of kids due to school closures, this new bill covers that, ? Did I hear that correctly? So I'm going to share one of my screens, if I can pull it up here. And this is our website has a summary of the new law on it. And this is the new FMLA leave entitlements. And each of these bullets are the qualifying events. The third qualifying event here, and I'll highlight it. I just want to make sure everybody can see. Brian, can you see it?
Absolutely.
So this is the language here. To care for a child of the employee who is under 18 years old if the elementary or secondary school or place of care has been closed or the child care provider of the child is unavailable due to a public health emergency. So vague, as a lot of these laws typically are. Public health emergency, I think as a general rule, we're in that. And this is pretty broad. This is if a school is closed or a place of care is closed or a child care provider is unavailable. I mean, there's a lot of stuff here that FMLA leave would extend under this situation. The other ones are, to comply with a recommendation or order by a health authority or healthcare provider that the physical presence of the employee on the job would jeopardize the health of others. And then here are the reasons: because these people were exposed to coronavirus or they have symptoms of it. And then this is the same, except you're taking care of a family member who has symptoms or was diagnosed. So I hope that answers your question, although again, it's fluid. This could change. We don't know what the final bill is going to look like, but kind of a plain reading of our summary, that's really what it is.
Hey, Jeremy.
Sure.
There's a question that came in that said, so this employer has employees all over the world managing projects. It's a nonprofit, and they've had a number of people that have returned back to the U.S. from spots that would be considered, I think, with their level 3 spots.
Okay.
Like this. And so the question, I think this is giving you some context for the question. It says, can an employer require a fitness of duty note to return to work even if the employer has asked employees to work from home?
So I think some of these things overlap with each other, right? So a lot of the guidance that's out there assumes that you have a workplace where people are working among one another and within close proximity to one another. So the rules that we've been advising clients on, okay, if the CDC says you've traveled from a country that has a severe level of exposure, and I think there's 4 levels of exposure under the guidance. If you've gone from a place that's like a level 3 or a level 2, you should, and you can, I think, under the current guidance right now, require that person to leave work, that they could work from home if that's possible, or you don't want to expose those folks to your people here. A fitness for duty, yes, I think you could in that circumstance require a fitness for duty for that person to return to the office. Again, that's the assumption. A lot of these rules are operating under the assumption that everybody's coming back to a physical location where they're exposed to other people. I'm less concerned about the risk associated with somebody who's working from home, who you've instructed they cannot come to the office, requiring a fitness for duty exam in order to work from home. I'm less concerned with that. They're not exposing themselves to your other employees. There isn't a risk of, kind of a negligence claim by that this person is potentially exposed and you're exposing your other employees. That risk isn't there. Of course, if you think that I think that's I'm not going to speculate. I think that's the concern that would be the thing that I would jump to, as opposed to a fitness for duty test in order to work from home.
Okay, great, thank you. So we still have a number of people that are on. So let's keep rolling. I've got a question here about I-9s. And what about checking ID within 3 days for the I-9? Has there been any guidance on this given the current state of affairs?
I'll take that one because I was actually just discussing that with somebody yesterday. So the standard I-9 procedure says that you have to have an employer representative fill out our part of the form, okay? But it's very open-ended on who is an employer representative. So the point is, it could be anybody that you're willing to designate that you trust to do it right, and do it on time. Oftentimes, we see notaries, lawyers, accountants, white-collar professionals who will ask to do it on our behalf. Sometimes we may need to compensate them. There are some services out there that I have advised my clients to use when they have employees who reside in other states where there's no manager that we can have do it, and where the employee is not coming to headquarters, so to speak, as an onboarding effort, where then it would be done at the local level. So if those services are still providing their service, then you could use them. And not to, I'm not here to speak for anybody. There's a lot of them out there, but like one of the companies I know, it's called N3 Notary, the letter N, number 3, N3 Notary. So if you look them up, you'll find other ones because you can Google it, and you know how Google works, right? If they're still providing their service, you could get that done. I think the cost is like $65, and a lot of companies use it, again, because they have remote employees. Now we're talking about people not meeting, social distancing. Will they still provide their service? I don't know. You have to check it out. So what do you do then? The rule has not changed. I cannot show you, oh, here's my passport, and do it online. I can't scan it. I can't take a picture of it and scan and text it to you. Nothing has changed that we have been informed of by the USCIS as of now. So find somebody that you can designate as the employer representative. And if it's somebody who's not trained in this, then I suggest you be on the phone and you walk them through every box of the I-9, because here's a 10-second I-9 lesson. Every error on the I-9 can cost you $220 up to a maximum of $2,100 and change per form. You don't want some rookie doing that form who doesn't know what they're doing. You walk them through it, you get it done, you're compliant, and life will be good.
Gotcha.
I mean, I would just add that
Go ahead, please.
no guarantee that USCIS won't issue some kind of guidance. They have issued guidance on other immigration issues, but it's possible. It could be they could waive they could waive some of the requirements. I just don't know, but we're not. I don't think we're at that point yet. But they're looking at it. There was one question I saw in the chat that I thought I would just really quickly bring up, and that was. Hold on, I think I lost it. There was a question about, whether or not you can afford the paid FMLA leave. So, and it's a question from a nonprofit. So first thing I would say is this law applies, first off, the new law applies to only employers with 500 employees or less. Okay, so that's one bit. Some of the other requirements of the FMLA, they all still do apply. If you're a small employer, very, very small, there are certain parts of the FMLA you're not a covered employer. So if you're super small and there's a concern about this cost, I would say that you need to look to make sure that you're actually a covered employer under the FMLA. There's some tests that determine that. So it might be that this law comes and goes and doesn't actually apply to you if you're very small. So that's one thing I would keep in mind. The other thing about not affording it is tough. These are kind of business decisions as opposed to legal compliance decisions. If this law passes as it currently is written, there might not be much relief for employers who have to bear that cost. As of right now, it's written that employers have to pay. Now, Adam mentioned that there might be a tax credit or some kind of recoupment. We just don't know whether that's in the new law or will be in the new law at the end. So keep up with it. And if you, like I said, if you contact me and I can sign you up for these alerts. Are literally like we're putting out blogs and posts every single day on our website that's got tons of information on it. Every time one of these new things rolls out, we're right on top of it.
I would just piggyback off of that to say, the law that we're talking about is related to the FMLA and the paid sick leave part.
Right.
What we're not talking about is this economic stimulus package that they're working on, because there's not even a draft out, right? I mentioned to you before that they pushed back the due date for paying your tax bill. So hopefully that money being available to you helps, right? Okay, great. The secretary, the Fed lowered their interest rates to like pretty much zero. Why? So that banks can loan to us. So this is the time to see about getting a loan, to see about getting a line of credit that you can utilize to make these payments until we get past July and August and business returns to normal. And if I read it correctly, and you're going to get those tax credits later, then what will happen is next year when you're filing your taxes, you'll either get credit and owe less, which will then offset. You can make your loan payments, repay the line of credit. Or if it's one of those things where, our tax bill is $8,000, but we've got a credit of 10, then they'll give you the other 2 back. Of course, I'm using simple numbers for the sake of this example here, right? So my friends in HR, it's time for you to have a heart-to-heart with your friends in finance, because they need to be tracking this from that side. So do you, but especially them. And you need to be able to talk to them about, here's the new obligations under the law, whether I'm paying full pay for the first couple of weeks and when there's an illness, or whether I'm paying 2/3 pay when somebody's home caring for children, right? All of those things, as they get finalized, are going to represent a financial liability to your firm. We need our friends in finance to be carrying their share of the load and saying, how are we going to do that? How much money is saved by delaying the tax payment? What does our credit look like now? What credit vehicles do we have access to presently, and what can we get access to? So I respect what you're saying. I'm a small business owner. I'm not sleeping very well these nights because all my clients are bringing me their worries and I got my own. But this is still the law of the land, at least in the preliminary stage. So creative problem solving, like I said earlier, time to figure out how do we make it work. And I'm not trying to be flippant, but what we know is what we know, so we got to figure it out.
So thank you both there. So we still have a number of attendees on. We have a couple of questions here. I'll just read through this first one. It says, what if an employee chooses to stay home, not showing symptoms, but would prefer to stay home? Should we be flexible to allow telework for this? Currently, we are only allowing on a case-by-case basis, and then in parentheses, parents with school closure. So versus, I think this is like a question of like legality and discrimination potentially versus just making a business practice or a business decision. So we'd like your feedback on that question in particular.
Right. So a couple different things to think about there. Most of my clients, before even me recommending one way or another, are looking at what are the policies that are the most flexible for their employees. I'll give you an example. My office in particular, we're one of 50 offices, but our office in particular went to voluntary telework starting this past Monday, right? And we have a couple people who are going to be in the office for small periods of time every day, check the mail, check the fax, kind of do sort of that stuff, make sure that there's not any deliveries and things like that. And then on a rotating basis, other people are in and out of the office, but it's still voluntary. So if you wanted to work in the office, you could. The case-by-case basis thing is fine. I don't see a whole lot of risk unless you have to think about what are the factors that you're using to make that case-by-case determination. I would caution generally against only people who have small children being allowed to work from home. There's not like a overt legal risk associated with that, but when you're kind of pairing up or you're dividing up your workforce into these groups that that are one thing and a group that's another thing. I mean, for example, in the District of Columbia, there's a specific protected classification for people who have familial responsibilities, right? And that's like age, race, gender, familiar responsibilities, among others. I would think about what line you're going to draw and whether or not drawing that line divides your employees into groups that are members of a protected class or not members of another protected class. I think it's a discussion. You have to have a discussion about what you're going to do. And it's, again, these things are changing every day. You know, we could be at a point in a couple of weeks where, who knows, the government just says everybody's got to box themselves in their house, right? And then you're kind of forced to do it. There'd be no other option. So be flexible, I think, is a fine creed, and evaluate it based on the needs of your business and the needs of your workforce. There's a balance here, and you know, I think HR folks like Adam, consultants like Adam, or attorneys like me who deal with these issues, we could help you walk through that. There are questions that are specific to every organization that might influence that.
Just to piggyback off of Jeremy's good point, you know, this is definitely the time where your communication skills are going to be challenged, right? You don't answer the question until you ask a few questions, right? Tell us, you know, what's your concern? What are you trying to get to? What's the problem you're facing? Because you want to have a good handle on things before you just start spouting out possibilities. Because, you know, as Jeremy said, you could be, you know, slicing up your workforce and making commitments that you might regret. So if somebody just says, you know, I want to work from home out of my other favorite watchword these days, abundance of caution, and I just want to stay home, I want to be safe. Well, I respect you want to be safe. And if you want to do that, I might be willing to be flexible, but you got to understand, as you make the choice that you're picking, if you work from home and I don't have telework, you're not getting paid. And if you don't have young kids, they're not going to be a basis for your payment under the new law, which we've already exhaustively discussed. And if you're not ill, you're not going to be eligible for payments under the new law. So are you telling me that you want to go home and just not work for a while? Because if that's what you're telling me, you need to have a full understanding of what that means. And oh, by the way, if you just don't want to come to work and you're not protected under any of these variations of the current or proposed legislation, then what you're basically saying is you don't want to work, and I may not have the ability to let you telework. Now, I already gave you like 10 options for creative telework work, but that's not going to fill in from now until June or July or August. So people are going to have to make hard choices for themselves. If I wanted to quit my job and crawl into a bomb shelter that I'm building in my backyard, I could do that. But my boss is not necessarily going to continue to employ me 6 months from now when I finally crawl out.
I do see a GovCon.
Challenging time.
I do see a GovCon question in the questions, Brian, if you want to look at that one.
Yeah, that was one on the list. So, so we are a GovCon and have folks in a skiff. These folks may be reduced to 2 or 3 days a week for work, but they are exempt. How do we address this with pay, benefits, eligibility? Ultimately, the government client is who's going to dictate the ability for these employees to report to work and what the schedules will look like, what they'll basically pay them for.
Right. This is tough. We talked about this when we were prepping. A couple different issues, right? Real quick on the issue of telework. If you have employees that are working in a skiff or in the intelligence community or in cleared environments, probably those folks are not going to be able to telework. That's going to be an issue you're going to need to deal with. I have clients who are working with the government customer to come up with like a shift system where people are kind of working around the clock, but in order to thin the numbers of the people who are in the office. That's one way that contractors are working through that, and I've helped some clients kind of navigate that with their government customers. Sounds like what you've got going on is the government might tell your folks that they need to go to a reduced schedule. This is just like kind of sequestration, just like furloughs that happened a number of years ago when the government shuts down. It's difficult. If you've got people who are working 2 or 3 days a week, I would strongly encourage you as a first measure, try to find other work for them during that time period when they're not physically located within the SCIF. That's very difficult. But it could be BD. You could reshift some people to BD for those other time periods, help them work on proposals for other contracts, help them develop the relationship with the client in a better way. There are things that you can do to get people to go to work, or to get people to have work to do in these 2 or 3 days where they're not working on site. Apart from that, it's complicated. Whether you decide to cut people's hours, whether you decide to reduce salaries, whether or not you decide to reduce benefits, all that, very complicated. Typically is a case-by-case thing. There's requirements under the Affordable Care Act for a number of hours worked that gives people eligibility for benefits. You have to kind of weigh it all simultaneously. It's a hard thing to answer right off, but you could be faced with some tough decisions about letting people go or reducing hours or reducing salary. That's a reality. It's not, impossible to imagine.
I'd like to add something there because I have worked in the GovCon space. We have GovCon clients, and Jeremy, jump in at the end of this here. So let's say you have Jeremy and I who both work for you, and we're both on site in a SCIF for the client. And the client says, okay, reduced work schedule. So maybe what you do, you say, okay, Adam, you're going to work this whole week. Jeremy's working 0. And the following week, Jeremy works the whole week. Adam works 0. And here's why I think that might be clean. And then I'm going to turn it over to the lawyer in the room to make sure I'm right. Under the Fair Labor Standards Act, an exempt employee works any hours in the week, you got to pay him for the week, subject to certain other variations that I don't think are applicable here. So if I work 2 days and he works 2 days, as Jeremy already said, we're trying to find other work to fill in the other 3 days because we're going to end up paying him for the week. But if Adam works the whole week and Jeremy works nothing, you have to pay him nothing. On the flip week, Adam works nothing, he gets paid nothing. This goes back to where we were talking earlier about, will people be able to use their PTO? And if they exhaust available PTO, will you let them go negative? And oh, by the way, an employee on PTO is not generating revenue for you. So if Jeremy is working 2 days, he's only working so much, generating so much revenue for you. Will you be able to afford to pay people PTO, both what they've accrued and potentially additional? That takes us back to where this conversation began earlier. Excuse me. So Jeremy, let me throw that back to you from an FLSA exempt, on duty, not on duty part of view. What else you got to add there, my friend?
That's one way of doing it, which is normally okay. You have to look at the work week. You've got to look at a couple other different things when you're talking about FLSA compliance. Another option is, and it's not necessarily the best option from an employee's perspective, but requiring the use of PTO during days in which they're not physically on site at a client. That is one other way that you can manage it. The person's going to get paid the same if they take 2 days of leave and they work for 3 days. So that's a way to kind of mitigate that. Going negative in the PTO, not always the best option from an employer. What if the person quits after the pandemic is done and you're kind of on the hook? There are options, but it does. I would also say, this is another point, is you all in the GovCon industry know you are at the mercy of your client. That relationship is very important. You need to guard that relationship, right? Because that's your source of revenue. So work really closely with the government, with your core, with your, the contracting officer. You really want to work closely with those people to kind of develop creative solutions to what they're requiring of you. This is a good time to focus on that relationship as well, because some agencies are more generous than others. They may not say, especially in the intelligence community, like the CIA is still working, right? There is that mission goes on, perhaps now more importantly than ever, right? When our kind of country is at a compromised state, the mission is as important as it has ever been. And so those agencies, my understanding and knowing some people who work there and knowing some contractors who work there, that they're not cutting a whole lot of time because they still have an important mission that isn't really directly impacted by the virus.
So we still have a number of people on, but I also need to be respectful of the panelist time as well. So maybe I've got a number of questions, and we can just kind of like do maybe a little bit more rapid fire. So one of them is, what's a furlough, and what's the right way to do it? So I don't know that it's necessarily an easy answer, but if you can give some insight into, we talked about today a little bit, furlough versus layoff.
Right.
Can I take that one?
Yeah, go for it.
So a furlough is where you basically say, don't come to work, I'm not paying you, but you're still an employee. I did see a question earlier and somebody said, hey, I'm a nonprofit. Can I do furloughs? Yes, anybody can do a furlough. Obviously, there's a lot of communication that goes into it. You have to analyze the way you structure it, right? Like I said, if you furlough an exempt employee for a week, you don't have to pay them. Whether you allow them to use PTO, we've already been over that and we're running out of time, so we're just going up quick. But they're still employed. They could go to at least in Virginia, they could go and claim unemployment. You may furlough them with a set end date, or you may furlough them open-ended because we're not sure when we're going to be able to bring them back. They're still an employee, so you still got benefits aspects and things like that. They still maintain their tenure, right? Their employment has concluded, but you're telling them, don't come to work. I don't have work. They're not paying you. It's like an unexpected unpaid vacation. That's the quick version. Next.
That is the quick version.
Yeah, there's a question that says, I work for a manufacturer. How do we address what Congresswoman Whitman sent, further reduced public gatherings, no more than 10 individuals? It says this does not include normal operations at essential services, which I think is ultimately one of the kind of key questions is what is essential services? But it says such as manufacturers, distribution centers, airport, bus, train, medical facilities, grocery stores, and pharmacies.
Right.
I guess that the question really revolves around this essential piece.
Right. First thing I would say is you have to keep an eye on your state and local authorities, right? So San Francisco is on a basic Italy-like shutdown right now. You're really not allowed to leave your home absent circumstances that are required, like going to the doctor, like going to the supermarket. That's what they're doing. So keep an eye on your state and local requirements. Right now, the federal guidelines are just that. They are guidelines. You could get yourself into trouble if you're openly flaunting them as an employer. I can imagine a situation in which you're getting yourself in trouble and there's some risk associated with that. Manufacturers, other employers, there are creative ways to kind of reduce your numbers at any given time when people are working. You can go to these shifts. You can go to like a night shift, morning shift, day shift, which essentially cuts the number of people who are physically located in your office by a third, right? Now if that's possible, you have to get creative, right? The idea of gatherings, right now it doesn't look like going to work, and if there just so happens to be more than 10 people is, quote, non-essential. I think what they're thinking of is concerts. They're thinking of conventions. They're thinking of going to the beach. There's, like I just read in Miami, they say that people are just flaunting it and they're going to the beach. There's thousands of people on Miami Beach. That's kind of what they're looking at. That's what the guidelines are pointed at right now. So, think about creative solutions for reducing the number of people who are in close proximity to one another, right? Help everybody. That's what we're doing. We're doing this to blunt the impact of the virus, right? So take a forward thinking, way of approaching that issue at work. But I don't think you have to, at this point, shut down operation because just so happens that 10 people are congregated with one another.
Good, thanks. Let's see. Last question that I have that I see in the Q&A, and then we'll close out. Say, if you have a new employee who needed to self-quarantine on his or her first day, how do you verify his or her I-9 documents? Is that just maybe a matter of maybe shifting the first day?
Well, I think part of it goes back to the conversation I had earlier about picking a designated representative and walking them through the process on the phone. That said, if somebody was coming to me and said, oh, I'm going to start work on Monday, and then something came up unrelated to the coronavirus, they said, oh, my kid's sick, I'd be like, okay, we're going to delay your start date till tomorrow, right? Things happen, I delay your start date. You're not even an employee yet. So if you came to me and said, I need to self-quarantine for 2 weeks, I might say, okay, I'm going to delay your start date. Now, that's my gut instinct. That's what I would want to do. But I am so hypersensitive to what's going on right now, I would probably call my friend Jeremy and say, Jeremy, if I delay somebody's start date, am I exposing myself to some sort of risk? So Jeremy, take it away.
There's always risk. It's another classic lawyer answer. The big area risk with saying to somebody, I'm just delaying your start date, is they've already quit their other job. And now they obviously can't go back to work during the interim. There's a chance that there's some period of time in which they're not employed. I can imagine a creative claim that says that that's some kind of actionable thing. You could be sued for that. It's possible. What I would do in that situation is, if you know ahead of time, I think Adam's point is well taken. Delaying the start date usually isn't a huge deal if it's a short period of time. We're in a time where we don't know what that is going to end up being. I think that there are ways that you could verify the I-9 things without, again, this is not a situation, we're not in a situation right now where everyone is under total quarantine. Also, would be extremely uncanny to me if I had a client call and say, the person who we hired who was supposed to start today actually contracted the coronavirus like yesterday and needs to quarantine. That, in my mind, is such a rare and remote consideration. I would probably do the same thing you normally do for all your employees right now, and then kind of massage it as we go along. If the quarantine measures get more serious and they get more severe, then maybe we're changing it. But right now, somebody can come to work and you can do that. They can come physically to work and do these things. You just, you have to kind of work within the current framework, though.
Good, thank you. So with that, I want to close. We had so Adam and Jeremy, awesome stuff. Great information, and thank you very much. We had talked, and a couple of our calls leading up to this and our planning sessions, that this likely would be like episode 1 of the Three Musketeers, to borrow a term from Adam, just because it's so dynamic, and what's happening today will be different tomorrow, Friday, and then on into next week. So it's highly likely, and I anticipate that everybody that's attended this will get an invite for one likely next week. We haven't gone to that planning phase because this came together so quickly. We didn't have the opportunity to get deep into what will we talk about next, although we knew there'd be tons of content to talk about that's relevant to small businesses, medium-sized businesses, just simply because it's unprecedented. So just with that, expect that there will be some follow-up on this. Jeremy and Adam's contact information has been provided. In the follow-up email, there'll be kind of an auto-generated email, but there'll also be individual emails out because the registrant list will be shared with Adam and Jeremy as well, so they have the opportunity to follow up with kind of specific things that they think will be of value to you as employers, things that came up, whether it's links to Jackson Lewis blog or articles that Adam has been a participant of or written, or other resources. I know I have a number of resources myself that I want to distribute out to the attendees from our content library. So expect to get some of that information, and then be in good health, and hopefully this doesn't have too drastic of a negative impact on your business. But thank you for your attendance. The fact that you attended this, I think, speaks to how you're trying to plan for tomorrow as well as next week and next month and on into the future. And if there are specific things that you want us to address, you have our contact information. We're happy to incorporate that into as we build out our next episode. So I'll close with that. Thank you so much for your time and attendance, and we look forward to engaging with you again in the future.
Thank you, everyone.
Wash those hands.
Yeah. Stay safe.
Wash those hands.